Welcome back. Seasonal affective disorder is more than just the winter blues. It is a form of depression. Nathan Miller is here now with Volunteer Behavioral Healthcare Assistant to talk more about why this happened. Nathan, good morning.
Morning.
Thank you for being here. So how do you define seasonal affective disorder? It's known as SAD, right?
Known as SAD,
Okay.
seasonal affective disorder, and it usually is it's a form of depression that usually happens between the months of, say, October and April of the year, and those are generally the darker times, regarding sunlight. So it's kind of related to that, and the lack of serotonin or the reduced serotonin in the brain is part of it.
So what do you mean by the reduced serotonin in the brain? How does...
Well, the light that we have, the natural lighting that we usually have, helps increase that serotonin and keep it at a normal level.
Really?
So during the darker periods of the months, of the winter, we usually have that reduced serotonin. So that's where this usually evolves from. And it's about 20% of the population may have some type of mild form of it. Some folks have others. When you're thinking about depression and this time of year as well, just because you may go through that, or you may have some of the signs and symptoms, doesn't mean you have SAD or seasonal affective disorder. You have to have more than 1 year in a row during the season, the darker seasons, not during the summertime when if you have depression in that's not going to count. So as well as some of the symptoms that go along with it. So it's it's pretty defined in itself.
So do you have to get an actual professional diagnosis?
Well, as far as getting a diagnosis, yes. But some of the signs that you could look out for, and some people experience some of these, or all of them, some don't, which are the isolation, overeating, lack of desire to socialize, weight gain, types of things like that. Some hopelessness may figure into that as well as oftentimes suicidal thoughts come from depression itself.
So when do people need to say, I need to actually seek out professional help, I need to take another step to address my mental health care?
Well, anytime that you're getting to the point where you're feeling bad, please seek help, at least some advice on help. See your local physician, your PCP, counselor, psychiatrist, talk to somebody about it. The thing with depression is a lot of times it's not viewed internally first, it's viewed by someone external, like a spouse or a loved one or a friend or coworker, something like that. They may point that out to you before you actually realize it yourself. And
it's a time of year when a lot of people are going to be gathering with their family and loved ones. So is it something that you should be looking for if you're, if you haven't seen a loved one in a while? Should you be looking for some changes in their personality or anything like that?
You can. I think it's always good to do that, because I think just at this time of year we need to be checking on each other anyway. So there's a lot of things that goes on during this time of year, and gatherings and holidays are always hard anyway. But seasonal affective disorder kind of sometimes figures into that and makes it worse as well.
So what can people do to help if they feel like they're seeing some of these symptoms, or if you're not at that point yet? What can people do to help themselves or their loved one? Well,
there's always the thing that medication management, counseling, exercising and eating right is always a big part of this. And there's a light box treatment that substitutes light. Some people, do that. I would advise, if you are looking at that kind of treatment, to subsidize the light loss that you have. Always see a professional about that, because that could be as harmful if you used inappropriately or uninformed as it could be, that you don't even use it.
All right, Nathan, thank you. We appreciate your insight as always. Folks, you can watch this segment again, hear this advice at WKRN.com.